You're 68 years old. You're standing in your kitchen making your morning coffee. No warning, no pain. Suddenly, the cup slips from your hand. Your left arm stops responding. She's having a stroke. But here's what separates Margaret's story from thousands of others. She didn't freeze. She didn't wait to see if it would pass. Within 45 seconds, her husband had called 911. He told the dispatcher exactly when symptoms started. 7:23 a.m. That timestamp would later save her life. Because here's what the American Stroke Association confirmed in their 2024 guidelines. For every minute a stroke goes untreated, the average patient loses 1.9 million brain cells. But patients who receive treatment within 60 minutes have a 47% higher chance of walking out of the hospital independently. Margaret received clot-dissolving medication within 52 minutes. Today, she's back to making coffee, playing with her grandchildren, living her life. Now, I want to be absolutely direct with you. Every 40 seconds, someone in the United States suffers a stroke. That's nearly 800,000 Americans every year. But the Framingham Heart Study, which has tracked cardiovascular health for over 70 years, discovered something remarkable. Up to 80% of strokes are preventable through lifestyle factors you can control starting today. 80%. That's not a typo. That's not wishful thinking. That's decades of evidence from one of the most respected studies in medical history. In the next 20 minutes, I'm going to share 7 evidence-based strategies that protect your brain from stroke. These aren't internet tips or folk remedies. These come from peer-reviewed research involving hundreds of thousands of participants. Number 5 changed everything for a patient I'll tell you about later. And number 1, the INTERSTROKE study, which analyzed 26,000 patients across 32 countries, identified it as the single most important factor you can control. But first, I need to make sure you know exactly what to do if stroke symptoms ever appear. Because all the prevention in the world means nothing if you don't act correctly in the moment. Before we get to the 7 strategies, do me a favor. Drop a comment with your age and one thing you do daily for your brain health. I read every single comment, and your answers help shape future content. Quick note, everything I'm sharing comes from published medical research, but always discuss changes with your healthcare provider. Your individual situation matters. Now, let's get into this. Here's what you need to burn into your memory. The word FAST, F-A-S-T. F is for face. Ask the person to smile. Does one side droop? A is for arms. Ask them to raise both arms. Does one drift downward? S is for speech. Ask them to repeat a simple phrase. Are the words slurred or strange? T is for time. If you observe any of these signs, call 911 immediately. Note the exact time symptoms began. This isn't optional. This isn't something to wait and see about. The American Heart Association's 2023 data shows that only 1 in 3 stroke patients arrives at the hospital within 3 hours. The rest wait too long. Many wait because they think the symptoms will pass. They don't want to overreact. They don't want to bother anyone. That hesitation costs brain cells. It costs independence. Sometimes it costs lives. So here's your rule. If something seems wrong, call. Let the professionals decide if it's an emergency. That's their job. Your job is to act fast and remember when it started. Now, let's talk about the 7 strategies that can help ensure you never need to make that call. Number 7, the morning hydration protocol. Most people don't realize this. During 8 hours of sleep, your body loses up to a liter of water through breathing and perspiration. You wake up mildly dehydrated every single morning. And dehydration thickens your blood. A 2023 study from Loma University tracked 20,000 adults for 6 years. They found participants who drank 5 or more glasses of water daily had a 41% lower risk of fatal stroke, compared to those drinking 2 glasses or fewer. 41%. From water. What makes this so powerful is the timing. Morning is when most strokes occur. Between 6 a.m. and noon, your blood is naturally thicker. Your blood pressure rises as cortisol peaks, and dehydration from overnight makes everything worse. Here's your protocol. Keep a glass of water on your nightstand. Before your feet touch the floor, drink 8 ounces. Not coffee, not juice, plain water. This single habit rehydrates your blood, signals your kidneys to begin filtering, and starts your circulation before you're even fully awake. I'll be honest, this one sounds almost too simple. But the research is clear. Hydration isn't just about thirst. It's about viscosity. Thick blood clots more easily. Thin blood flows more freely. Your morning glass of water is stroke prevention in its simplest form. Number 6, the 10-minute movement minimum. Now here's something that surprised even me when I first saw the data. You don't need intense exercise to protect your brain. You need consistent movement. The Copenhagen City Heart Study followed over 7,000 adults for more than 20 years. Participants who engaged in just 15 to 30 minutes of moderate activity daily had a 27% lower stroke risk than sedentary individuals. But wait, here's where it gets interesting. A 2022 meta-analysis published in Stroke, the Journal of the American Heart Association, found that even 10 minutes of walking provides measurable benefit. Not running, not gym workouts, walking. Let me tell you about Harold, a 74-year-old retired postal worker from Cincinnati. When Harold came to our clinic, he hadn't exercised in 8 years, arthritis in both knees. Thought his active days were behind him. His baseline was concerning. Blood pressure 152/94, resting heart rate 88. He could barely walk to his mailbox without getting winded. We started small. 10 minutes of walking every morning. Not fast, just moving. After 3 weeks, his blood pressure dropped to 140/86. After 3 months, he was walking 30 minutes daily. His resting heart rate dropped to 72. His doctor reduced his blood pressure medication. Harold told me something I'll never forget. He said, "I thought exercise was about losing weight or building muscle. I didn't know it was about keeping my brain alive." He was right. Movement does something medication cannot. It increases blood flow through the brain, delivers oxygen and nutrients, and stimulates the release of something called brain-derived neurotrophic factor. Think of it as fertilizer for brain cells. Here's your protocol. Find 10 minutes. Morning works best because it jumpstarts circulation for the high-risk hours. Walk around your block. Walk through a store. Walk in place while watching the news. The activity matters less than the consistency. Number 5, blood pressure mastery. Okay, pause here. If you take nothing else from this video, take this. The INTERSTROKE study I mentioned earlier analyzed risk factors across 32 countries. Their conclusion? High blood pressure accounts for more strokes than any other single factor. Nearly half of all strokes can be attributed to hypertension. Nearly half. But here's what makes this both terrifying and hopeful. The systolic blood pressure intervention trial, called SPRINT, followed over 9,000 adults over 50. They found that reducing systolic blood pressure to below 120, compared to below 140, decreased stroke risk by an additional 23%. Every 10 points of systolic pressure matters. It's not binary. It's not safe or dangerous. It's a gradient. Lower is better within healthy limits. Now, I know what some of you are thinking. My blood pressure is fine when I check it at the doctor's office. Here's the thing. White coat readings can mask problems. Home monitoring tells the real story. The American Heart Association recommends checking blood pressure at the same time each day, ideally morning and evening. Sit quietly for 5 minutes first. No talking during the reading. Record the numbers. If your systolic pressure, that's the top number, consistently reads above 130 at home, talk to your doctor. This isn't about fear, it's about information, and information gives you power. Here's your protocol. Get a home blood pressure monitor. They're about $25. Check twice daily for 2 weeks. Bring those numbers to your next appointment. You'll know more about your stroke risk than most people ever will. Number 4, the Mediterranean Brain Shield. There's a reason scientists keep returning to the Mediterranean diet. It works. And we have the data to prove it. The PREDIMED trial, conducted across Spain, followed over 7,000 participants at high cardiovascular risk for nearly 5 years. Those assigned to a Mediterranean diet supplemented with extra virgin olive oil had a 30% lower rate of major cardiovascular events, including stroke. 30%. From food choices. But let me break down what makes this diet specifically protective for your brain. First, extra virgin olive oil. It contains oleocanthal, a compound that reduces inflammation in blood vessels. Inflammation is what makes plaques unstable and likely to break off and travel to the brain. Second, fatty fish. Salmon, mackerel, sardines. These deliver omega-3 fatty acids that improve blood vessel flexibility and reduce clotting. Third, leafy greens. Spinach, kale, arugula. They're rich in nitrates that your body converts to nitric oxide, a molecule that relaxes blood vessels and improves flow. Fourth, nuts, especially walnuts. A Harvard study tracking over 120,000 participants found those eating 5 or more servings of nuts weekly had significantly lower stroke risk. Here's what the Mediterranean diet excludes that matters just as much: processed meats, refined sugars, and excessive sodium. Each of these promotes inflammation and raises blood pressure. Here's your protocol. You don't need to overhaul your entire diet tomorrow. Start with one change. Replace your cooking oil with extra virgin olive oil. Add 1 fatty fish meal per week. Swap afternoon chips for a handful of walnuts. Small substitutions. Massive protection over time. Quick pause here. If this information is opening your eyes, tap that subscribe button. We break down evidence-based health strategies every week, and I don't want you to miss the upcoming video on the 3 morning mistakes that age your brain faster. All right, back to number 3. Number 3, sleep quality, not just quantity. This one catches people off guard. You can sleep 8 hours and still be at elevated stroke risk if the quality is poor. A 2021 study from the American Academy of Neurology followed over 30,000 participants. Those with obstructive sleep apnea had double the stroke risk compared to those without, even when controlling for other factors. Double. Sleep apnea causes repeated oxygen drops throughout the night. Each drop stresses your cardiovascular system. Your blood pressure spikes, your heart works harder. Your brain receives inconsistent oxygen for hours while you think you're resting. Here are the warning signs: loud snoring, waking up gasping or choking, morning headaches, daytime fatigue despite sufficient sleep hours, a partner who says you stop breathing periodically. If any of these sound familiar, please discuss a sleep study with your doctor. Treatment options like CPAP therapy don't just improve energy, they protect your brain. But even without apnea, poor sleep quality increases risk. The key metrics are sleep onset, how quickly you fall asleep, sleep efficiency, the percentage of time in bed actually sleeping, and sleep architecture, whether you're achieving adequate deep and REM stages. Here's your protocol. Keep your bedroom cool, around 65 to 68 degrees. Stop screens 1 hour before bed. Maintain consistent sleep and wake times, even on weekends. Consider a sleep tracker to identify patterns. Quality sleep is active brain protection, not passive rest. Number 2, stress and your arteries. I want to share something that changed how I think about stroke risk entirely. In 2015, researchers at Massachusetts General Hospital published a landmark study in the Lancet. They used brain imaging to show that activity in the amygdala, your brain's fear center, directly predicted future cardiovascular events, including stroke. Here's what happens. Chronic stress triggers your amygdala. Your amygdala signals your bone marrow to produce more white blood cells. Those cells cause inflammation in your arteries. Inflamed arteries are where clots form. Stress doesn't just feel bad. It physically damages your blood vessels. Let me tell you about Eleanor, a 69-year-old former accountant from Atlanta. After her husband passed away, she spent 2 years in what she described as constant, low-grade anxiety. Couldn't sleep, lost interest in activities, felt her heart racing for no reason. Her doctor ran standard tests, cholesterol normal, blood pressure slightly elevated but not alarming. Yet Eleanor felt something was wrong. A specialized inflammatory marker test showed her CRP, that C-reactive protein, was significantly elevated. Her arteries were under stress, even though traditional numbers looked acceptable. We worked on stress management, daily meditation, just 10 minutes, regular calls with friends, a gratitude journal. Sounds soft, doesn't it? Like it couldn't possibly matter for something as serious as stroke. After 6 months, her CRP dropped by nearly 40%. Her blood pressure normalized. She told me she felt like herself again for the first time in years. Here's your protocol. Identify one stress reduction practice you'll actually do. Maybe it's 5 minutes of deep breathing when you wake up. Maybe it's a weekly phone call with an old friend. Maybe it's 10 minutes in the garden. The activity matters less than the consistency. Your arteries respond to calm just as they respond to chaos. We're almost to number 1, and trust me, you'll want to remember this. It's the single factor with the strongest evidence, yet it's the one people most often dismiss. But first, make sure you're subscribed so you don't miss our deep dives every week. Number 1, know your numbers. This is it, the foundation everything else builds on. The reason I save this for last is simple. You cannot manage what you do not measure. Every strategy I've shared today becomes more powerful when you have baseline data and track your progress. Here are the 5 numbers that predict your stroke risk better than any symptom ever could. Number 1, blood pressure. We covered this. Target below 120/80 for most adults. Check at home regularly. Number 2, LDL cholesterol. This is the low-density lipoprotein that builds up in artery walls. The American College of Cardiology recommends under 100 for most people, under 70 for those with additional risk factors. Number 3, fasting blood glucose. Diabetes dramatically increases stroke risk. A fasting glucose above 100 signals pre-diabetes. Above 126 indicates diabetes. Both require intervention. Number 4, atrial fibrillation screening. AFib, an irregular heart rhythm, increases stroke risk 5-fold. It often has no symptoms. Ask your doctor about screening, especially if you're over 65. Number 5, carotid artery ultrasound. This painless imaging shows plaque buildup in the arteries that feed your brain. It's not standard screening, but if you have multiple risk factors, ask about it. Let me share one final story. Thomas, a 71-year-old engineer from Phoenix, felt completely healthy, no symptoms, walked daily, ate reasonably well. He almost skipped his annual physical because, quote, nothing was wrong. His doctor ordered routine blood work anyway. His LDL came back at 182. High, but he had no idea. A follow-up carotid ultrasound revealed 60% blockage in his right carotid artery. He was a ticking time bomb with no symptoms whatsoever. Today, Thomas is on appropriate medication. His blockage has stabilized. He told me, I was 1 year away from a stroke I never would have seen coming. That's the hidden nature of stroke risk. It builds silently. You feel fine until suddenly you don't. Numbers reveal what feelings cannot. Here's your protocol. Schedule a comprehensive blood panel if you haven't had one this year. Ask specifically about LDL, cholesterol, fasting glucose, and inflammatory markers. Request blood pressure monitoring supplies. If you're over 65 with any risk factors, ask about carotid screening. Knowledge isn't just power, it's protection. Now let me bring this full circle. Remember Margaret from the beginning? The woman whose morning coffee was interrupted by a stroke? I checked in with her family recently, 18 months after that terrifying morning. She sent me a photo. She was at her granddaughter's ballet recital, holding a program, smiling widely with both sides of her face. No droop, no residual weakness. Her daughter told me something I want to share with you. She said, Mom always thought strokes just happened. Now she knows they're often preventable. She checks her blood pressure every morning. She walks every day. She drinks water before coffee. She says she feels more in control of her health at 70 than she did at 50. That's the transformation I want for you. You've just learned 7 evidence-based strategies that can dramatically reduce your stroke risk. Hydration, movement, blood pressure control, Mediterranean nutrition, quality sleep, stress management, and knowing your numbers. You don't need to implement all 7 tomorrow. That's not how lasting change works. Start with one, the one that felt most relevant to your life. Maybe it's the morning water glass. Maybe it's getting a blood pressure monitor. Maybe it's finally scheduling that physical you've been putting off. Try it for 2 weeks. Notice how you feel. Then add another. Because here's what I've learned after years of studying brain health. Small steps, taken consistently, create massive protection over time. Your brain doesn't need perfection. It needs attention. If this video helped you, I'd be grateful if you'd subscribe and share it with someone you care about. A parent, a spouse, a friend who dismisses their health a little too easily. Next week, I'm releasing a video on the 3 warning signs of silent brain inflammation. 90% of people miss these completely. Subscribe and hit the bell so you don't miss it. Drop a comment telling me which of these 7 strategies you're starting with. I personally read every single one, and your questions often inspire future content. Thanks for investing 20 minutes in your brain health today. That investment compounds. Take care of yourself. You deserve protection. And now you have the knowledge to create it. I'll see you in the next one.